My name is Mohan and I'm a plastic surgeon in Dallas, Texas. Today I'll be describing a study that's going to be published in Plastic and Reconstructive Surgery journal. The title of the study is Architecture of Fat Grafting, Impact of Cannula Diameter. Fat grafting of the face, breast, and buttocks has become a very hot topic. It's widely publicized in the media, and it's something that we as plastic surgeons discuss heavily in all of our national meetings. With these procedures, we're always striving to figure out what are the best techniques and what will improve fat graft survival. This particular study is interesting in that they looked at two factors and its effect on fat graft survival. They looked at cannula diameter and the amount of actual fat graft. To summarize the results, what they found is that a smaller cannula diameter, or the tube that's used to inject the fat, they noticed that smaller globules of fat were injected. So the smaller the fat is, the more likely that it'll get greater blood supply and survive. Secondly, they injected different amounts of fat. With smaller amounts of fat, they noticed that there were smaller globules of fat injected, and these also have a greater chance of getting better blood supply and survival. This study is great, especially for facial fat grafting, because the cannula diameters that are used and the injection volumes that are used are very similar to what we do clinically. But what would be great in the future is if we had clinical studies where we looked at larger cannula diameters as well as larger volumes of fat and see how much survived. And if we had long-term outcomes and used imaging modalities such as MRI to measure volume and fat graft take, that'd be very useful to help us figure out which parameters are best to improve fat graft survival. I think that this is definitely a great study that will impact clinical care and has taught us a lot, and I feel that in our field we'll have much more to come in the future. Thank you.